Peter Zanoni, Corpus Christi City Manager, and today we're coming to you with this video. This replaces the in-person meeting that we have been having with the Health District employees every Friday now since October. We know that the recent spike in COVID cases, most likely from Omicron, as well as 6 to 8% of the Health District employees is actually being out with the virus, which is similar to the rest of the employees. We have about 200 employees that are out with COVID. Because of those factors and the fact that the Health District employees are trying to address the community once again, we thought it'd be better to provide you with a video message rather than coming to meet in person as we generally have been on Fridays. So this video will give you an update on what has happened since we last met. As I mentioned, we've been meeting since October on Fridays, and it'll highlight the week that's coming up. This week is critical as we negotiate with the county for the future of the Health District or the City Health Department. And so I'll share those messages with you in this video. As we know, I want to remind us now, even more than ever, is why we're doing this. This being creating a new business model to provide health services to the community. We know that this community, our Corpus Christi and Nueces County community, deserves better health outcomes. We know that we want to be more mindful of how we use taxpayer dollars to provide these critical services to the community. We can be more efficient in how we do that. And then third, the reason we're doing this is to have a better work environment for our and the county employees. We know that for at least 2 decades, there's been numerous studies that have been done that point out that the workplace is less than desirable for our employees and for the county employees as well. So just to remind us, we're doing this for better health outcomes, better use of taxpayer dollars to provide health services, and a better work environment for our employees. And now more than ever is the right time to do this, especially with the pandemic continuing to impact our community. As I mentioned, this week coming up is critical. The City Council will meet on Tuesday, tomorrow, and then the Commissioners Court has scheduled a special meeting on Wednesday. And both at the City Council meeting and in the special Commissioners Court meeting, the deal points that the city and the county chief negotiator, Jenny Dorsey, have developed will be discussed by both governing bodies. The City Council will be provided an overview of what the city team with Jenny Dorsey, the county Commissioners Court appointed lead attorney, have developed. We know that the City Council approved creating a separate department in our city, and we still are moving in that direction. However, several commissioners on the Commissioners Court wanted us to take one more look at a potential new model that we could use instead of having a city department. And that new model is one where the Health District would remain intact. However, the city would be the 100% operator of it. So all duties and responsibilities would be with the city, and we would continue to keep the Health District and provide services not only to the city, but for a fee to the county, to their unincorporated areas and some of the smaller towns that are inside Nueces County, like Banquete or El Duce or even Robstown. And so to be fair to the county and to some extent the community, my team, myself and my team have decided to work with the county negotiator on that potential business model, which is one where the city, again, would run the Health District 100%. Today, we know the business model is one where it's 50-50 or 60-40, where both the city and the county run it. But we've said it many times before that when 2 entities or 2 people are in charge, generally nobody's in charge. And so that's been the result of that failed business model for many decades. So this week coming up, City Council Tuesday will review the deal points of this concept that we've been working with Jenny Dorsey on. And then on Wednesday, the Commissioners Court will review it as well. Now, I have been keeping the mayor informed as we've been negotiating. We've been negotiating with Jenny for several weeks now. And we've been doing that in good faith and in a very professional, positive way. We speak highly of Jenny. She's done a great job. as has the county auditor as well, Francisco. And so we appreciate them. They have done a great job for the Commissioners Court and for the county, for that matter. Our team consists of myself, Steve Vieira, our attorney, Miles Risley. And so this week, Tuesday, we'll talk to the City Council in executive session about the business deal points of the city being the 100% operator of the health district. We sent to the City Council last week the deal points. It's a 3-4 page document, so they've had a chance to review it. And I want to point that out because some of the council members do have some questions and some concerns in some of the deal points. I'll be meeting with some council members before Tuesday, and then we'll meet with all of them on Tuesday. And this is how our business works. The city develops professional recommendations, and then the City Council is ultimately the one that has to set and adopt policy, and that's our business model. So it could be that what we think is a good recommendation, the policy setters, the mayor and the City Council don't. Maybe they want some changes to it, and that's normal in this business. So we will see what happens on Tuesday. We're confident, though, that this business model that we've negotiated is a good one, not only for the city, good for the city taxpayer, but also good for the county and the county taxpayer. And so we will work with the council, the mayor and the City Council up on Monday and again on Tuesday. So Tuesday is critical on our side because we'll see how the policymakers, the mayor and council, what they think about these deal points in that business model option. Now the week is critical because then on Wednesday, the Commissioners Court will, for a second time, actually review these. A week ago Wednesday, they looked at them, but didn't have enough time to vet each of the items out. They did approve one item in the deal points, and that is the date that it would become effective. That's a March 1 date, but they didn't consider or approve any of the other deal points. And so on Wednesday, they will review the rest of the deal points and consider approving them or not. Our mindset is that hopefully on Wednesdays, the Commissioners Court will approve them pretty much as they are today. If the Commissioners Court approves the deal points in the format substantially that they're in today, that'll be a good thing. If they don't, if there's a lot of changes or they only approve a few, then the city is going to be positioned to have to withdraw from the district, as City Council has already approved. That date is the following Tuesday, January 18, and that's what we've been working on. The health district employees know that. We've been working on a 10-point business plan to set up a separate city department. And so that is our choice. That'll be our choice or our option on Tuesday, Wednesday. We'll see what City Council does on Tuesday, and more importantly, we'll see what the Commissioners Court does on Wednesday. And so if the court decides to approve the business points that have been negotiated with Jenny and the city, then we'll move in that direction most likely if City Council approves it on Tuesday as well. But if there's a scenario where the City Council approves them in substantially the form they're in today, but the Commissioners Court doesn't on Wednesday, or if the Commissioners Court wants to add more language to it that might give the county more control in the health district otherwise, or beyond what's in the negotiated deal points now, then the city will move to our other option, which is setting up a separate city department. And that's what we've been working on, and that's what City Council has approved. So all that to say, this week is a critical week. We know that the 18th of January, which is the City Council approved withdrawal date, is the following week on Tuesday. And so we will keep the health district employees informed. We'll send you an email both probably Tuesday after the City Council meeting and then again on Wednesday after the Commissioners Court meeting so that we continue to social distance. And then we'll do another video recording that we'll send to you by the end of the week that'll give you more information wrapping up the week in review, if you will, from the City Council meeting and the Commissioners Court meeting. So what I want to do now is review with you, the employees, the new model that the county has proposed that the city consider. That is that the health district remains, it would still have two partners, the city and the county, Nueces County. However, there would only be one operator. That would be the city. The city of Corpus Christi would control and run the health district 100%. the county would buy services from the health district to provide critical health services to unincorporated Nueces County and some of the smaller towns and communities that are within Nueces County but not in the city, like Robstown and Banquete and Agua Dulce, as an example. And so that model is one that we have looked at, and we've spent several weeks working with the county commissioner's appointed lead negotiator, Jenny Dorsey. And I want to go over that with you now. And so, as I mentioned, it would be one that the health district, it would be a model, a business model, in which the health district would remain. That would make it easier in the transition with grants. It would also have all the employees that are in the district today through an application process get a chance to apply to be in the same health district, instead of having some employees going to the county health district and some going to the city. It may also provide a little bit of efficiency because it could eliminate some duplication of services if the city has a department and then the county has the health district. So those are some of the positives in this potential new business model. And so in the business model, the city would have the sole and 100% authority to hire employees, to direct their workflow each day. The city would have the discretion exclusively to terminate employees, and that includes the health director, the assistant director, the local health authority, and many of or all of the division heads, I should say, not many, but the division heads. And so that district model is one, again, where the city is 100% in control. The county would delegate its authority to appoint and evaluate and direct or terminate the director, the health director, or the health authority to the city manager pursuant to health and safety codes that exist on our books. Now, one benefit to the county employee is that for those county employees that are exempt employees who are within 2 years of vesting with the county, we would allow those employees to remain county employees for that 2-year period. However, they would report to the city, and their work would be directed by the city. They'd be evaluated by the city. But it would give them 2 years remaining to work as a county employee. They would be a county employee. And then they could get to that 8-year point where their money that they're putting into the retirement system, the county's match, would be secured for them. And so today, if they were to leave 6 years into working with the county, they wouldn't be there 8 years, and they would not get all the match money that the county has been putting into their retirement system as they've been contributing along the way. So we think this is a very positive benefit to this model that the Nueces County commissioners and their lead negotiators have recommended to the city. All employees, as I mentioned, even those county employees that may stay with the county to vest, would be subject to city policies, city rules, and regulations, and the city would have full authority over their hiring, their work performance each day, or their work plan each day, as well as their evaluations. This includes all employees that are funded by grants as well. And so today we know some of the grants are county grants, some are city grants, but all those county grant positions would come into the city. They would be city employees at that point. The county, as I mentioned earlier, would pay for services to be received by this health district. Even though they're a member of the district, they would pay for services. We would negotiate with the county each year with the known fact that we would agree to the payment by July 1, several months before the budget has to be presented to the city council or to the commissioners court and adopted ultimately. And so by July 1 of each year, the city, working with the county, would have a negotiated agreement of how much service the county would want from the district and what that cost would be. And we would do that by July 1. If we can't reach an agreement by July 1, if one side or the other is in disagreement with the cost or the services, then the city would not, or the health district would not provide those services. There would be a pretty tight deadline that July 1. We would want an agreement to be reached. If not, then the city health district would just opt out to not provide those services. So that's a critical part. We've seen that across the state of Texas when cities and counties have agreements, it can often lead to a non-agreement, and things go on for months and months and months, and we don't want that here. So we put into the negotiated deal points that July 1 of each year, we'd come to an agreement, and then we could proceed at that point. Two other things that would benefit the county that the city is in agreement to doing is the county asked through their negotiator that the city health district or the health district provide services in Robstown, Texas, in the Calderon building. That's going to be remodeled, so that'll be a suitable site to have a health clinic. And so the new health district would provide 2 days of clinical services out of that Calderon building. That's a real big positive for Robstown. And then secondly, the county has a mobile bus, a mobile health command bus, and the new health district would provide services twice a month in that bus to rural parts of the community. The bus would be maintained by the county. It's owned by the county today, so the county would continue to own it. They would maintain it and fuel it, and then the staff in the new health district would operate the bus and have sufficient healthcare workers, and twice a month we would go out to various areas in Nueces County to provide services. So that's another positive improvement that would be added. Both the Calderon, Robstown services and the bus services would be factored into the price that the county would ultimately pay the health district. And so that's an important point to point out. We don't want to have the city taxpayer subsidize necessarily somebody that doesn't live inside the city limits. And one other point is that we annually will, as I mentioned, evaluate those costs for services. Today, there's some disagreement maybe in terms of is the city paying too much, is the county paying too much, but the fact of the matter is that's one of our weak areas, and that's one of the reasons we want to change the business model is the actual finances, the revenues and the expenditures are very a little bit murky, and so by having one entity in control, we'll be able to better assess and manage the budget. And so we'll work towards that as well to make sure that each entity is paying the appropriate amount and that the revenues and expenditures are appropriately accounted for, whether they're coming from the city or the county. So I think that's a summary of this new model, which is, again, one where the health district would remain intact. It would have a sole operator, that would be the city of Corpus Christi. Nueces County, through an annual budgeting process, would agree to buy services, and the city and the county would agree on a rate or a payment from the county. The agreement extends additional services to Nueces County to include in Robstown, and then with the use of the mobile bus through other areas of the county. There's extreme protections in there for the county employee that today is probably one of the areas of greatest concern. The county employees, after an interview process, could work for the city. And for those county employees that are almost vested, there's a great benefit for them in this contract or in these deal points, which is they would have 2 years to vest with the county and they would not lose their retirement match money. So that's a real big positive for those county employees. So that's a summary of the negotiated business model. And as I mentioned, the City Council will consider this on Tuesday, and then the Commissioners Court will consider it again on Wednesday. And we'll keep you, the health employees, informed of their actions and deliberations, both on Tuesday, Wednesday, through email, and then we'll send you another video message before the end of the week.